Associates in Women's Healthcare is dedicated to offering women a total women's healthcare experience. From gynecological services and menopause to weight management, they have the expertise to help guide you through every phase of your life. And here to share more about their practice, location, and women's health concerns is Dr. Sharon McMillan. Thank you for being with us.
It's a pleasure, Laura.
So first off, you guys have a new location.
We do.
Tell us about it.
Well, we're at 200 Silver Street in Agawam. I've been a gynecologist for 25 years. And I thought about what would be the perfect gynecologist's office. Elegant and professional and modern and warm and relaxing, and I went out and I built it.
Well, that's great, because lots of times women, they don't want to go there because it just feels so cold.
Right.
And so you've created almost a spa-like experience.
We call it an oasis in the middle of a busy day.
Oh, well, that's nice. Makes going to the doctor a little easier.
Yeah, it does.
And you also have a business philosophy that I think is wonderful. Tell our audience a little bit about that.
Well, we really believe our motto is empowerment through health and wellness. Women have a very difficult time in life. They're doing their mother's job, they're doing their father's job, they're taking care of their in-laws, their parents, their children. They have this much time in a day for themselves. So when they take time out of their busy life to have their annual exam, we want to make it the best experience that it can be. We have half-hour visits because we want people to not be hurried and to have time to go through a complete history and family history, and to make sure that we give comprehensive care.
Right, that's great. And speaking of taking care of yourself, one of the things that women worry about taking care of is menopause, and that is one of your specialties.
It is.
First, tell us, what are the symptoms of menopause?
Hot flushes, night sweats, insomnia, irritability, short-term memory loss, depression, panic attacks, anxiety, and what I like to call a little too much honesty.
What exactly does that mean?
When you're 50, you'll find out.
Oh, okay. I guess that's something to look forward to.
Absolutely.
But you were saying with menopause, we were talking earlier, that one of the biggest questions you get is people come in and they say, why can't I sleep at night?
Right, exactly. And a lot of women have these symptoms long before their period stops. They don't necessarily realize that those are symptoms of menopause. The day before your period, at 2 o'clock in the morning, is when your estrogen level is the lowest of the whole month. So you wake up and you're a little sweaty here and on the back of your neck, and you just feel like you can't go back to sleep. You're not really sure why. And then the next month it happens, and after a while you start to realize it's happening just right before your period. That's the insomnia of menopause. You fall asleep fine, but you wake up at 2 in the morning. And ways to increase your estrogen naturally will help you to sleep better through the night.
Okay, and speaking of ways to increase it naturally, what are some of those ways so women can be aware?
Well, there's
natural
herbs.
remedies.
There's a great herb called black cohosh, not blue cohosh, black cohosh. One of the best brands is called Remy Femin, and you can buy it at Costco or CVS for about $20 a month. It's very mild. You have to take it twice a day, and if you don't take it twice a day, it's not going to work. You have to take it for a month before it kicks in, but after a month of taking it twice a day, most women find that they're sleeping better at night. And it's a simple, easy thing to do with usually no side effects. Also adding soy to your diet, because soy is a plant-derived estrogen. And definitely staying away from caffeine and alcohol. Alcohol is the killer. Red wine at night before you go to bed, you might as well just plan on being up at 2 in the morning.
Why is that? If alcohol and caffeine, why is that so bad for
We
people
don't
going
know,
through
but
menopause?
you just, for some reason, and I know myself because I'm in menopause and I take hormone replacement therapy. Normally I sleep fine, but if I have alcohol at night, I know I'm going to be up that night.
All right, and you just said that you take hormone replacement therapy. Tell our audience a little bit about that and how it can help.
Well, the symptoms of menopause are all due entirely to low estrogen. So the lower your estrogen, the more your symptoms. The higher your estrogen, the fewer your symptoms. You can bring your estrogen up naturally with soy and flaxseed oil. But for people who try that and it's just not enough, hormone replacement therapy is a great alternative. You add in estrogen and progesterone because they balance each other. And that pretty much resolves the symptoms for most people because that was all that they were missing.
Right, and some women, they have been hearing a lot about bioidentical hormones, and is it worth it?
Definitely not. Bioidentical hormones, you send a swab that's personalized to you off to the pharmacy, and they create a little chemical compound of the 3 different kinds of estrogen and say this is made just for you. So it's kind of like L'Oreal, you're worth it, you know. But the thing is, your liver can take any one of those three and change it into all three of them, and it does whatever it wants to do as soon as you take it in your body. So if you take the main component, estrogen 2, estradiol, which is what we give people, it's natural, it's plant-derived, it comes from Mexican yams and soybeans, but it's prescription, so your insurance covers it and it's FDA regulated. Then it'll go through your body and your liver will say, all right, well, I got 100% of estrogen 2, but I want 10% of estrogen 3 and 15% of estrogen 1, and it just switches around and it makes it bioidentical. So you don't need to spend money doing that.
Okay, so people think, oh, this is just made for me, I'm going to spend lots of money on it, but it turns out just to be a waste.
Exactly.
Okay, so if you could give women one tip if they're going through menopause, what would it be?
Education. Learn about what's going on with you. There's a book called The Change Before the Change by Dr. Corio. It's phenomenal. Basically what it does is it's an owner's manual for perimenopause. What's normal, what's not normal, what foods make it better, what foods make it worse. If you get educated so that you know that this is a normal symptom, not to worry about it, or this is not a normal symptom, I should call my doctor, then it's not such a frightening process to live through, because everybody lives through this transition. You really can't get away from it.
No, you can't. Well, thank you for being with us today and giving us all the details on menopause.
Pleasure.
Tell us where your new location is one more time.
200 Silver Street in Agawam, right across the street from Geisler's.
Great. Well, thank you again for being with us.
Thank you so much.
And to learn more about the services offered at Associates in Women Healthcare, call 413-209-9394 or visit associateswomenhealthcare.com.